All right.
Yep, looks great. All right, my name is PJ, Preston Lee Jr. I am the peer recovery program coordinator for the Department of Behavioral Medicine and Psychiatry at WVU. And I just wanted to talk to you guys today about uh, integrating peer support into professional areas, specifically for this echo into child protective services. Um, I have no disclosures, either financial or otherwise. I didn't add a disclosure slide to it, so I'll do that orally. Um, and the agenda is it's pretty. I kept it pretty basic. We're going to talk about what peer support is, what peer recovery support specialists are, the types of support that they provide, some data surrounding peer recovery support specialists and CPS in other states where that has already been integrated. My slide just disappeared.
Yes, I see that. Hold on just a second. I don't really know what happened. Just trying to tell you that you're recording the top. Oh
Ah,
my
there
goodness.
it is.
There we go. Sorry about that.
And we'll also talk about how peer recovery support specialists could be integrated with uh, CPS, specifically for folks that have substance use disorder. Next slide, please. So we'll start with some basics. What is peer recovery support? So, peer recovery support is an evidence based practice in which individuals utilize their own personal experiences and training to support and guide other individuals through the difficulties that they are facing in recovery or any other situation that they may be facing. Next slide. So, what is a peer recovery support specialist? A peer recovery support specialist, or PRSS, is an individual in long term recovery from substance use disorder who is authentically and actively engaged in a recovery pathway. They are individuals with the personal lived experience with substance use disorder recovery and specific training that uniquely qualify them to provide guidance and support to help others initiate, maintain, and navigate the complexities of treatment and or recovery. Um, and the peer relationship kind of looks sort of like this. That relationship between the PRSS and the individual in or seeking recovery is rooted in trust and focused on providing that individual with the tools, resources, and the support to help them achieve long-term recovery and improve, of course, improve their quality of life. Or in the in the context of this, hopefully help them be able to reunify with their children. So, the types of support that are provided by a PRSS, peer recovery support is a powerful tool in substance use disorder treatment and recovery. It involves providing support to individuals in many different forms, which include emotional support, that's that empathy and concern, informational support, those are connections and referrals to information and community resources that support health and wellness. Instrumental support, which includes those concrete supports such as help with housing or employment, writing resumes, things of that nature. Affiliational support, and those are connections to the community at large and to recovery community supports, activities, and events. The other ways peer recovery support specialists provide support to individuals are by being advocates for those individuals. We are their voice when they don't know how to use their own voice. We are mentors. We provide a living example of what recovery can look like. We are fellow journeyers. We're also people in long-term recovery. We are consultants. We help them form and reach their recovery goals or treatment goals or both. We are also listeners. We hear and understand what they're going through because most of the time we ourselves have gone through the same and similar things uh, in the course of our uh, substance use and treatment and recovery. Next slide, please. So, peer recovery support specialist in professional settings. Peer recovery support specialists already successfully work in a wide range of settings, including recovery community centers, recovery residences, inpatient treatment centers, drug courts, and other criminal justice systems settings. Sorry, hospital emergency departments, homeless shelters, behavioral health and primary care settings. Peer recovery support specialists take an active role in outreach and engagement within all of these settings. Um, like I mentioned, peer recovery support is an evidence-based practice. They've studied this for quite some time in a lot of different settings, and it's been proven to increase retention rates in treatment and recovery. And as we'll talk about a little bit later, it's also improved reunification rates for people with substance use disorder and their children. And with all that in mind, it just makes sense to integrate them into the Child Protective Services setting to provide support to individuals with substance use disorder who are currently involved in and navigating that system. Next slide, please. So, peer recovery support specialist and CPS. What might that look like? Next slide. So, the first question is why utilize peer recovery support specialists? So, PRSS programs have demonstrated positive outcomes for participating families, such as improved treatment completion and recovery rates for parents, less time for children spent in out of home care, and improved reunification rates. These programs also offer unique and innovative solutions to barriers and provide valuable collaborative lessons. Uh, you know, Hopefully the people get to learn from our experience so they don't have to find out the hard way. In one study, parents who utilized peer support had 4 times greater reunification with their children than parents who didn't have that peer support. In a second study, parents who utilized peer support had a 5.6 times greater reunification than parents that didn't have peer support. And those studies come from a variety of different areas. There's one study was conducted in Connecticut, another in Illinois, one in Kentucky, one in California, and one was a nationwide study that was conducted, looking at all of the programs in the various different states that had peer support connected with child protective services in that area. And it really has showed a lot of positive outcomes in just the few studies that I've looked at. I thus far I've only taken a look at 5, but each one of those have shown positive outcomes for those families and for the people with substance use disorder and their children. Next slide. So, the continuation of why utilizing PRSS is a wonderful idea. By utilizing the peer recovery support specialist alongside CPS case managers, it could help reduce the caseload burden that many CPS case managers face today. I think we all know that's an issue just about everywhere, not only in the state of West Virginia, but from the folks I've talked to in other states and other areas, that's an issue that a lot of different areas face. Many peer recovery support specialists have the lived experience at navigating the CPS system and can use that experience to help other or parents, sorry, do the same. A lot of us have been through this already in our own lives and with our own children and have been able to successfully navigate that. Uh, so that makes it really easy for us to guide these folks. And peer recovery support specialists can advocate for integrated care teams and also advocate for parents during MDT meetings for those parents who may not know how to go about advocating for themselves. We can be their voice when they don't know how to use their own. And those integrated care teams are much like the treatment teams that are utilized at inpatient treatment facilities, outpatient facilities, and in hospitals. Uh, in those settings, they generally call them treatment teams, but that integrated care team would be like um, the judges, the lawyers, the CPS caseworker, the peer recovery support specialist, um, someone such as Anna, if she's involved in that also, and bringing all those people together uh, in the interest of getting these individuals connected to the services and the help that they need. And peer recovery support specialists can also help keep the parents motivated and keep them on track with the recovery and reunification plan. We can work closely with them to make sure that they're following up, make sure they're going to meetings if that's what they need to be doing, make sure they're making the appointments that they need to make, make sure they're doing all of the things that they need to be doing to hopefully be reunified with their children at some point. Next slide, please. So, some potential peer recovery support specialist roles and responsibilities in that CPS setting. So, number one, they would potentially arrange and accompany or transport parents to needed meetings and or assessments. Number two, they would help that parent develop recovery capital. Number three, they would visit families in the home or in the community to help provide the support that they need. Number four, they would monitor parents' treatment attendance in and participation in self-help groups. Five, they would assist the parents in accessing services and overcoming barriers to recovery. Number six, they would offer parents assistance navigating the child welfare system. Excuse me. Number seven, attend court sessions and MDT meetings to speak on behalf of the family. Number eight, serve as a liaison between the substance use disorder treatment, child welfare, and the courts. Number nine, help child welfare and court professionals understand substance use disorder treatment and the recovery process. Number 10, serve as an advocate and speak on the parent's behalf. And these are just some of the ways. I didn't feel like we would have enough time. My sister and I actually sat down a couple of years ago and wrote a standard operating procedure for peers and CPS. It's a little more detailed than this. Um, if anybody would be interested in a copy of that, and it's just a brief overview of some of these things, along with some others that show, you know, how that peer would operate within that system. Because we can, peer recovery support specialists can work a lot more closely with these individuals than a therapist can, a psychiatrist. Um, we have the unique ability to, either transport them places, meet them at places, go into their home and provide this support in many, many different settings uh, that traditional helpers don't have the ability to do. Um, and that's important in helping them to address and overcome those barriers that they might be facing. And that motivation part of it is also a big piece of this. We can help keep them motivated, uh, because oftentimes, you guys know the judge and the lawyer and the CPS caseworkers just do not have the time or can't work closely enough with every single person to accomplish that. We can work more closely with them and make sure that they're going to self-help meetings if they're mandated to go. Make sure they're showing up for their uh, drug tests on time. Make sure they're reporting to whoever they need to report to uh, when and where they're supposed to. And we can also provide education surrounding substance use disorder and treatment and what recovery looks like to the child welfare system in general, to the judges, to the lawyers, to CPS caseworkers who may not know uh, exactly what treatment and or recovery look like. All right, next slide, please. So I tried to keep this kind of brief and just hit the really high points. Um, so some of the final takeaways: peer recovery support specialists could be an integral support for parents navigating the child welfare system. Um, we could be that missing link that they need to help provide them the support to navigate sometimes complex systems. Uh, Peer recovery support specialists could also help ease the burden experienced by a lot of CPS case managers. We can do a lot of that footwork that needs to be done in connecting them with and making sure they follow up with the resources that they need to be successful. Uh, and peer recovery support specialists could help improve the overall outcomes for families and children. Peer recovery support specialists could also help professionals better understand treatment and recovery. That way, we talked about that integrated care team. That way, that whole team is on the same page. The judge understands what's going on with their treatment and recovery. Their lawyer understands what's going on with the treatment and recovery. Their caseworker understands what's going on with that. So everybody is on the same page and sort of working toward the same goal, which is hopefully reunification at some point. Um, and I'm not sure, do we have a case presentation after this?
So we do not. So it's just
Okay.
the tactic. So if you want to take some more time, you can.
All righty. Well, I kept it kind of short. But I don't have slides for it, but I do have this standard operating procedure that we can take a look at some of these other things
PJ, I
before we
also
go
had
on.
a question. I just wanted to, if you could kind of expand on, you mentioned, one of the roles of peer recovery support specialists is to help clients really develop recovery capital. Can
Yes.
you say more about so that's kind of a catchword for SAMHSA these days. Can you say more
Yeah.
about like what your conceptualization of recovery capital is and how peers can help with that?
So recovery capital is it is anything that I, as a recovering person, can use to advance or enhance my recovery, and that covers a lot of things. Recovery capital uh, that covers that covers just about anything that's involved in my life. Whether it be uh, having a car, having a driver's license, having a job, having a home, um, having a support network. Those that recovery capital comes in a lot of different forms, um, and it's not only like those concrete forms. There's also these internal forms of recovery capital that come from, um, like for me, for instance, that comes from me going to support group meetings and me talking to and interacting with other people in recovery that help remind me that recovery is possible. um, but that recovery capital can be anything that I find beneficial to my recovery. And those are the things that we help these individuals build. If they need to work on saving money to buy a car, we can help them develop a little savings plan as part of their recovery plan. And all of this recovery capital is what goes into building that recovery plan for that individual. We assess what they don't have, but then we also focus on what they do have to build the things that they do not have.
Thank you. Yeah, I think of it sort of as what we used to refer to as protective factors, right?
Yes.
I think that peer recovery support specialists are in a unique position because often there's a lot of shame and guilt around how much someone has lost in the process of active addiction, and it can be harder. What I've observed is it can be harder for patients to share that even with their therapist or provider or CPS. But because the peer recovery support specialist gets it and has been there, sometimes that shame and guilt is really not a barrier to asking for help in the same way that it might be in a professional setting or from a CPS worker. And so I just wanted to share my experience of working with peer recovery support specialists in the ED in the outpatient setting has been the primary things that I have seen huge impact on is reduction of stigma in the healthcare setting. So peer recovery support specialists are moving around in the healthcare space and are living, breathing examples of successful recovery. Like in the ED, a lot of the providers there do not see successful recovery because that's not who's coming into the ED. Or people in the hospital, people are very sick in the hospital, and they don't see when people get better on the outside. And so peers are an example of that, not only to professionals, but to the people that they work with. And that, like, I did this, you can do this too. And that's incredibly powerful. I just wanted to add that.
Yeah, thank you, Laura. In my experience, these individuals are much more likely to tell me what is really going on in their life at any given time than they would be to tell the doctor in the emergency department or anybody else, because they understand that, oh, well, this is a person in recovery that has probably been in a hospital just like me, and they're a lot more. And that's one of the unique things about peer recovery support specialists is we have that lived experience that helps us connect on a much deeper level with these individuals, and they're much more likely to be uh, honest and forthcoming with us.
And there's a Whoop, there's a comment in the chat that I just wanted to read. Does recovery capital include the social connections and inclusion and organized recovery groups? Quote, "You are not alone." National and worldwide network of people with similar stories and experiences. Like, would that qualify as like what you think of as recovery?
Yes, that qualifies as there's several different areas that would qualify as social capital. That's that connection to the community at large.